Bantal. Good morning. So today I am going to teach you another topic of general pediatrics, that is vitamins. Okay. So what are the vitamins? They are organic compounds required in small amounts. That is why they are also called micronutrients, and they are required for maintenance of health, metabolism, and normal growth. They are not synthesized in body and must be obtained from diet. A vitamin may have several functions. Vitamins are not chemically same. All vitamins are different chemically. Now its classification based on their chemical properties, vitamins are classified either as number one, water soluble vitamins. Number two is the fat soluble vitamins. What are the water soluble vitamins? Vitamin B complex, as there are many vitamins like B1, B2, B3, B5, B6, B9, B7, B12. So these are collectively known as vitamin B complex. Then vitamin C and folate. They all are collectively known as water-soluble vitamins. Vitamin B complex acts as a precursor for enzymes, for enzyme cofactor biomolecules, that is coenzymes, and that acts as a catalyst and substrate in metabolism. And another type of vitamins are fat soluble vitamins. They are vitamin A, D, E, and K. So these four vitamins are fat soluble vitamins. They control protein synthesis at either at either transcriptional level or post transcriptional level, and they perform diverse biochemical functions. So today, out of these fat soluble four fat soluble vitamins, I will take vitamin K, which is very important vitamin. Why? It exists in two major natural forms. K1, that is phylloquinone. Second, K2 is menaquinone. Now, sources are vitamin K1 is present in plants as large leafy greeny vegetables and certain legumes and plant oils. Second, it has the form used to fortify the foods and as a medication in US. Vitamin K2, it is synthesized by intestinal bacteria, also present in meat, liver, and cheese. It is used as pharmacologically in some countries. Vitamin K3, that is menindione, is a synthetic form of vitamin K and not used medically as it can cause hemolytic anemias. Breast milk is deficient in vitamin D and vitamin K. So the breastfed babies, exclusive breastfed babies, they have to be given vitamin K regularly, supplement and vitamin K at the birth. So how it is absorbed and how it is metabolized in our body. Absorption of vitamin K requires bile and pancreatic juice. As you know, this is fat soluble. The dietary vitamin K is absorbed in the jejunum, incorporated into chylomicrons and delivered into the circulation via lymph. The liver is the primary site of action of vitamin K. And the total body pool of vitamin K is small, 80% begins in the liver. And due to the limited store, manifestations of vitamin K deficiency appear within a few weeks of depletion, either due to the lower intake or malabsorption. Physiological functions. Vitamin K is necessary for synthesis of clotting factors, that is 2, 7, 9, and 10. Main role of vitamin K is cofactor in the post-translation carboxylation of glutamic acid to form delta carboxyglutamate in the liver, which facilitate chelation of calcium ions to glutamate and platelet phosphates, which is essential to operate coagulation cascade. This you all have studied in the biochemistry also. While vitamin K deficiency may have a deleterious effect on the long-term bone growth and vascular health. As you know, they are required in the coagulation process also. So nutritional requirement, this is a made by the combination of dietary intake and microbiological synthesis. Requirement of newborn is 3 to 5 micrograms per day. At 2 years of age, 10 micrograms per day. Older children, 10 to 30 micrograms per day. Vitamin K deficiency. Mainly it affects newborn, earlier known as hemorrhagic diseases of the newborn. It is a syndrome of severe systemic bleeding and ecchymosis appearing in the first week of life and predominantly in breastfed infants because it is deficient in vitamin A. Now, bleeding can occur from various sites such as GIT, nasal bleeds from the umbilical cord, stumps, then post-circumcisional sites, and intracranial hemorrhages. Now, it is known as a vitamin K deficiency bleeding, VKDB, that is vitamin K deficiency bleeding, VKDB. VKDB is of three types. First is the early VKDB. Early means so newborn, especially preterm babies, are more prone to develop this vitamin K deficiency within 1 to 14 days of birth due to the following reasons. Number one, vitamin K does not cross the placenta, so it is the maternal vitamin K stores are not transferred to the baby. Second, they don't have adequate bacterial flora to form vitamin K as newborn gut is sterile. Third is the breast milk, also is poor source of vitamin K containing only 2 micrograms per liter of phylloquinone. Then bleeding may be so severe that baby may require blood transfusion. So all babies require vitamin K at birth. Now after हेलो अरे ध्रुव ये तो जूम की मीटिंग ही खत्म हो गई आईफोन ही आना बंद हो गया वो बीच में गोल गोल घूम रहा था सारा डिस्कनेक्ट हो गया है फिर वो रिकॉर्डिंग में जितना है उतना रिकॉर्डिंग में जा रहा है बंद हो गया ना तो हॉटस्पॉट से ये साइड आना भी बंद हो गई थी तो साइड ही खसक लेके आ गई Second type is late vitamin K deficiency bleeding. Most commonly occurs at 2 to 12 weeks of age, rarely up to 6 months. Causes are almost all babies are breastfed infants. Then children with cystic fibrosis have malabsorption of vitamin K. Then polystatic liver diseases, example biliary atresia, alpha antitrypsin deficiency. These children also may have the vitamin K deficiency. Bleeding is mostly intracranial, which may cause convulsions, neurological sequelae, and death. And without vitamin K, prophylaxis incidence is 4 to 10 per 1 lakh newborn. Third form of VKBT, it occurs at birth or somewhat later. It is secondary to maternal intake of medication. Like if mother is on the long-term anticoagulant like warfarin, or she is on the anticonvulsant phenobarbital or phenytoin, or they so because they cause the placenta and interfere with vitamin K functions. So maternal medication, due to maternal medication, they may have third form of VKD. Vitamin K deficiency in older children. Apart from newborn, vitamin K deficiency may occur patients on chronic antibiotics, which eliminates GIT flora. So the GIT synthesis is not there. Second is malabsorption syndromes, example cystic fibrosis, biliary atresia, short bowel syndrome, celiac disease, then cholestatic liver disease, pancreatic disease. Diagnosis is the lab findings, platelet, prothrombin time, and partial uh, thromboplastin time are prolonged. So PT and PTT are prolonged. Then platelet count and fibrinogen level are normal. Prolonged PT corrects rapidly after giving vitamin K and stops acute bleeding. So if you are doing on the first day, PT is prolonged, and when you give the injection vitamin K and then you repeat and it corrects rapidly, so it is confirmed that it was vitamin K deficiency. In my vitamin K deficiency, PUCA2 may be elevated. PUCA, what is PUCA? It is protein induced by vitamin K absence. Protein induced by vitamin K absence, PUCA. So if there is absence, it is raised. The differential diagnosis, DIC, that is disseminated intravascular coagulation, associated with low platelet count and low fibrinogen levels, usually due to septicemia. While in vitamin K deficiency, platelet count will be normal and fibrinogen levels will also be normal. Then second differential diagnosis, severe liver diseases result in decreased production of other clotting factors. So PT does not fully correct with vitamin K. So I told you that if it is rapidly corrected vitamin K, that deficiency is confirmed. But if it not in the liver diseases, it may not be controlled even in spite of giving vitamin K injection. Treatment infant with BKDB, 1 milligram of parental vitamin K, then the PT should be decreased within 6 hours and normalized within 24 hours. For rapid correction of adults in adolescent, 2.5 to 10 milligram parental vitamin K and fresh frozen plasma. Children with vitamin K deficiency due to malabsorption, then require administration of higher doses of oral vitamin K, that is chronic, to 2.5 milligram twice a week to 5 milligram per day. Parental vitamin K may be necessary. Oral vitamin K is ineffective. Of prevention, administration of a single injection of vitamin K, 1 milligram intramuscular to all term babies, 0.5 milligram to all preterm babies at the birth. It is very effective in preventing VKDB. So that's all about the vitamin K. And I hope you understood about this very important fat soluble vitamin K. So now today I'm going to teach you about one of the most important water soluble vitamins, vitamin B complex. So vitamins, they are organic compounds are requiring very small amount micronutrients maintenance of health, metabolism, and normal growth. They are not synthesized in body and must be obtained from diet. A vitamin may have several functions, and all vitamins are not chemically same. Yeah, I've told you initially also when I introduced you vitamins to us and classification also. Two types of vitamins are there. Water soluble vitamins are vitamin B complex, vitamin C and folates, and fat soluble vitamins are vitamin A, D, E, and K. So today we are going to learn about this vitamin B complex. That is one of the most important water soluble vitamin. Water soluble vitamins are unique are unlike fat soluble vitamins. They are not stored in the body. Exception is vitamin B12, which is stored in the body in some amount. But apart from that, all they have to be supplied from the dietary sources. So regular supply is needed. They are not synthesized in the body. So their deficiency develop in a so unlike fat soluble vitamins, they are not soluble. रिज्यूम हो गया है पर स्लाइड्स कहाँ आएंगी इधर आ गई पैसे देख लो पहले का हो गया कि नहीं रिकॉर्ड Unlike fat-soluble vitamins, they are not stored in the body, and so their deficiency develop in a very short period of time. Excess is excreted in urine, so toxicity is very rare, even in very high doses, and they mostly access coenzymes in various intracellular metabolic reactions. It is advisable to treat deficiency of a specific vitamin B with entire B complex of vitamin B12 and not that specific vitamin of B complex. So first of them important is vitamin B1, that is also known as thiamine. Its biological action is it is essential for glucose metabolism and cellular energy generation from carbohydrates. Thiamine, pyrophosphate, active form of thiamine is important cofactor in the citric acid cycle that is active in brain and heart. B1 is also involved in nucleic acid and fatty acid synthesis. Absorption thiamine is absorbed efficiently in the GIT. So, what are the sources of the thiamine? As you know, they are not synthesized in the body. They have to be taken from the dietary sources. So, it's RDA I will use in all the vitamins. That is, you should know the full form. That is the uh, recommended daily allowance for infant is 0.4 milligram per 1000 calorie. For children, it is 0.8 to 1.2 milligram per 1000 calories. What are the dietary sources? Vegetarian, among the vegetarian sources, human milk, cow milk, legumes, unpolished grains, and unpolished grains. So if one person is eating polished grains, he will have immune deficiency. Cereals and nuts. Animal sources, meat, liver, and kidney. Thyme is insensitive to heat. Like if the things are cooked, it will be vanished from that food source. Then sulfite sterilization, sulfites, if it is treated with sulfite, if it is sterilized, or pasteurization, like if milk is pasteurized, all the vitamin A, B1 contents is lost and lost in cooking water also. So if the cooking water is drained, they all vitamin B1 is drained. So what occurs in their deficiency? There occurs a disease known as beriberi. Most infants and children obtain vitamin B12 in adequate amount from food and don't require supplements. Thiamine deficiency results in beriberi that affects people who consume polished rice as a staple diet when intake is below 1 milligram per day. So it's very rare to occur because usually if they have only staple diet is the polished rice and intake is less than 1 milligram per day, then only the deficiency or beriberi will develop. Three forms of beriberi are described. Number one is dry beriberi. Number two is wet beriberi. Number three is infantile beriberi, and another type of beriberi is encountered is vernix encephalopathy. So dry and wet beriberi. There is irritability, peripheral neuritis, tingling, burning, and paresthesias of toes and feet, paralysis of lower limbs, loss of deep tendon jerks, muscle wasting, and loss of position sense. That is occurs in the dry beriberi. And wet beriberi, it is evident from the name. Wet means there should be an fluid, accumulation of fluid. So it is very, very so congestive cardiac failure and peripheral edema is there in the wet beriberi. Then what is the third form of beriberi? We have learned dry and wet beriberi. So I told you the third form is the infantile beriberi. So it is evident from the name that it occurs in the infants. So most subtle in onset and occurring in breastfed infants of thiamine deficient mothers who may not have signs of beriberi or with very low intake of thiamine. The clinical picture is dominated by cardiomegaly, cyanosis, dyspnea, and aphonia. The disease may result in death after a few weeks in infantile form. So this is very serious if it is not diagnosed early and not treated early. Then lastly, Wernicke's encephalopathy. It may occur in thiamine deficient infants and children and consist of a triad of mental confusion, ataxia, ocular abnormalities like ophthalmoplegia and nystagmus. अरे बहुत समझते हैं फिर आप भी वापस आ गए इन प्रोग्रेस so hemorrhagic lesions may be seen in the thalamus and periventricular gray matter. So encephalopathy means the involvement of the brain, and you see all the symptoms pertaining to the CNS mental confusion, ataxia, ocular abnormalities. They occur in Wernicke's encephalopathy. Apart from this, hemorrhagic lesions also occur in the thalamus and periventricular gray matters. Some problem in recording.